Hey everybody. So I'd like to talk to you a little bit about the research that has been done about the internet use that is being done by patients to gather information regarding their health. But I'd also like to talk about my own experience because I am a dental hygienist and I have been practicing for 21 years, so I definitely have experience in what this change it looks like for the relationship between practitioner and patient, because I have seen both without the internet use 21 years ago and with the internet use now. So I've definitely seen how it has impacted my relationship with my patients. Research shows that there is a lot of use of the internet being done out there by patients. Back in 1998, 54 million people were using the internet to research information regarding their health. That went up to 110 million in 2002, and then up to 117 million in 2005. So we've definitely seen an increase. It's now 2019, so I'm sure those numbers are even higher. 80% of adults in the United States will use the internet to research information regarding their health. And then of that 80%, 50% of people will actually take that information to their doctor and ask them questions about the specific information that they researched. There's advantages and disadvantages to this internet use by patients. One advantage is the patient is well informed when they come in. That's always nice. Also, it's more efficient use of time when they're actually in the office because they've done some research, so you don't have to give them every bit of information regarding the subject because they've already gathered quite a bit of information sometimes. So you can actually ask them questions about what they already know about the topic, so that way you can kind of get down to the nitty-gritty of what they don't know before you give them information. So it's definitely a more efficient use of time in many cases. Also, access to medical records personally is helpful. For example, I'm a patient of Kaiser, and as a patient at Kaiser, I'm able to access my medical records online. So I'm able to look up, say, test results before my doctor calls me. Sometimes the doctor won't even call me. I'll just access that information online. I'm also able to review a previous appointment. There'll be a summary of the visit available online, so I'm able to access that information if I forget some detail that I needed to know. There's some disadvantages as well. There's a lot of low quality information on the internet from sources that are not credible, and patients sometimes don't know how to recognize the difference between a credible source and quality research versus bunk information or information that is of low quality that is not helpful for them to know. It just can confuse people, actually. Also, a disadvantage is low-income people. Low-income patients have less access to the internet, so that can be a disadvantage too. It can disadvantage them significantly because when they come into the office, we sometimes assume that they have just as much internet information as anybody would. So it's important that we distinguish which portions of the population or which of our patients don't have the information that maybe another patient would have. So that's a disadvantage. So my own personal experience is, like I said, I have seen a change in my relationship with my patients because of the internet. I particularly see it as a positive change, but what I see now that the internet is being used more frequently is, for example, with new patients. When they come into the office, they come in with high expectations and they are internet savvy. They have done their research. They usually did quite a bit of research before even choosing us as a dentist, as a dental office. So they come in with high expectations. They know what sets us apart, what makes us different than other offices. For example, our office really values individual choice, and we mention this online on our website. We really value individual choice. We respect patients' personal values, their individual values. So patients come in expecting that from us, and so what that requires from us is that we have a high level of communication with our patients. It's a huge part of the patient encounter, and it can make or break our relationship with our patients right out of the gate. So it's very important that we come into the situation as medical dental practitioners with a highly skilled level of communication. In the text, I thought it was very interesting. In the text, it mentioned the basic structure of the narrative between the patient and the practitioner as being an open to closed cone, in terms of mentioned asking open-ended questions during the working phase of the interview. And that really hit home with me because that's exactly what I do. I have to be skilled at asking the right types of questions to get good information from my patients. I can't ask questions usually that just require a simple yes or no answer, because that does not give me any information. It gives me very little information. So asking good questions is huge, important in my field and in my office particularly. I see this with established patients. They research information online regarding products, for example. I have patients that come in that have questions about mouthwashes, toothpaste, new whitening products that are on the market, all a variety of different products. And they want to know, I need to be prepared. I need to do my own research ahead of time so that I know, are these products effective? What are the ingredients in the products? Are there side effects? Is there anything better out there for that particular patient? I have to know the answers to these questions, and sometimes I won't know. And so, for example, something that's popular that I recently didn't know a lot about was charcoal toothpaste, for example, charcoal products in general for oral healthcare products. So that required me to tell the patient, I wish I had the answer for you right now, but I don't. So let me do a little research, and I'll email you later. I find emailing patients is more effective because it can be written by me and read by them at a time that's convenient to both of us. And I also like the fact that I can include links, internet web links, so that they can access the same information that I accessed. Policy implication or solutions to the trend for using the internet to gather information. I think that it's really important that we have good policies on who we hire in our office. We need to have people that are internet savvy, lifelong learners, that there's an ongoing curiosity for learning, and that curiosity to know more. People that are flexible for after hours email, after hours research, and also continuing education classes, so that we know what information is out there for our patients. Also, I think a good policy is ongoing communication training for new hires. That must be part of employment with all of our people in our practice, or anybody in the medical field. This is important because of this use of the internet being such a big thing. There needs to be ongoing training as part of the employment in healthcare facilities. Also, important that frequent research of new products and procedures to be able to answer patients' questions. Just that actual frequent research is written into the job descriptions of all medical employees. We need to be able to answer patients' questions in a prompt, professional, intelligent way. So I think ongoing research should always be part of any policy for healthcare professionals. Anyway, that's it. Have a great day and have a good Memorial Day weekend.